Botulism is a rare but serious illness caused by toxins produced by the bacterium Clostridium botulinum. The disease is characterized by muscle paralysis and can be life-threatening if not treated promptly. Clostridium botulinum thrives in low-oxygen environments and produces one of the most potent neurotoxins known to science. While botulism cases are relatively infrequent, they remain a medical emergency due to their severity and potential fatality. Types of botulism. Botulism can manifest in several forms, each associated with a different mode of exposure to the Clostridium botulinum toxin. Foodborne botulism. This occurs when people consume food contaminated with the botulinum toxin. It is often linked to improperly canned, preserved, or fermented foods that were not processed correctly to destroy the spores. Home canned foods, particularly low-acid vegetables like green beans or beets, are common culprits. Wound botulism. Wound botulism occurs when C. botulinum spores infect an open wound and produce toxins. This is more commonly associated with intravenous drug use, especially with contaminated needles, but it can also occur in other wounds exposed to soil or debris containing spores. Infant botulism. This form affects babies under 12 months old and is caused by the ingestion of C. botulinum spores, which germinate in the immature gut and produce toxins. Honey is a well-known source of spores and should not be given to infants under 1 year of age. Inhalation botulism. This rare form can result from inhaling aerosolized botulinum toxin. It has been studied in the context of bioterrorism but is otherwise not a natural occurrence. Iatrogenic botulism. This form can result from the overuse or incorrect application of botulinum toxin in medical or cosmetic procedures, such as Botox treatments. Causes and mechanism. Botulism is caused by the botulinum toxin, which targets the nervous system. The toxin blocks the release of acetylcholine at the neuromuscular junction, preventing nerve signals from reaching muscles and leading to paralysis. Clostridium botulinum is an anaerobic bacterium, meaning it thrives in environments with little to no oxygen. Its spores are highly resistant to heat and can survive in soil, water, and food for long periods. Symptoms of botulism. The symptoms of botulism typically appear within 6 hours to 10 days after exposure, depending on the type of botulism and the amount of toxin ingested or produced. Common symptoms. Foodborne botulism. Nausea and vomiting. Dry mouth. Difficulty swallowing or speaking. Blurred or double vision. Muscle weakness starting from the head and moving downward. Paralysis of respiratory muscles in severe cases. Wound botulism. Symptoms similar to foodborne botulism. Fever and swelling around the infected wound. Infant botulism. Poor feeding. Weak cry. Constipation. Loss of head control. Floppiness, hypotonia. Diagnosis. Diagnosing botulism involves a combination of clinical evaluation, patient history, and laboratory testing. Physicians may suspect botulism based on the patient's symptoms and potential exposure to contaminated food, wounds, or environments. Confirmation often involves detecting the botulinum toxin in the patient's blood, stool, or suspected food source. Electromyography, EMG, testing can also help identify characteristic muscle abnormalities caused by botulism. Treatment. Botulism requires immediate medical attention, as it can progress rapidly. The main goals of treatment are to neutralize the toxin, support vital functions, and address any underlying infections. Key treatment steps. Antitoxin administration. An antitoxin is available for adults and children older than 1 year. For infants, a specific botulism immune globulin, baby BIG, is used. The antitoxin prevents the toxin from causing further damage but does not reverse existing paralysis. Supportive care. Severe cases may require mechanical ventilation if breathing muscles are paralyzed. Patients may remain on ventilators for weeks or even months in extreme cases. Wound care. Wound botulism requires surgical removal of infected tissue and antibiotics in addition to antitoxin treatment. Rehabilitation. Recovery often involves weeks or months of physical therapy to regain muscle strength and function. Prevention. Preventing botulism involves understanding its sources and practicing safe food handling and wound care. Food safety. Properly can and preserve food, following recommended guidelines. Boil home canned foods for 10 minutes before consumption. Avoid giving honey to infants under 1 year old. Wound care. Keep wounds clean and covered. Avoid using contaminated needles or injecting drugs. Medical and cosmetic procedures. Ensure botulinum toxin is administered by qualified professionals. Complications. If untreated, botulism can lead to respiratory failure, long-term muscle weakness, death, in 5 to 10% of cases. However, with prompt treatment, most patients recover fully over time, although the recovery process can be prolonged. Conclusion. Botulism is a rare but potentially deadly disease that requires rapid recognition and treatment. Advances in medical care and public awareness have significantly reduced the prevalence and fatality rates of botulism. By adhering to proper food safety and wound care practices, the risk of botulism can be effectively minimized.
Thank you for watching. Please subscribe our channel.